This is the abdominal assessment presentation. Be ready to practice on somebody. There probably will not be time to practice during class time. However, the skills for abdominal assessment are a little bit more basic, so it shouldn't be too difficult to practice on somebody at home. Lesson objectives are similar to previous presentations. The demonstration part, again, there won't be time in class, so you'll have to practice on someone at home, or meeting a fellow student at school is fine too. And then identifying normal and abnormals. Just a basic anatomy physiology review for the GI tract. Of course, we start with the oral cavity at the top, goes down through the esophagus. Parts of the abdominal system or the digestive system would be the liver, which is located on the right side of the body. You've got the stomach more toward the bulk of it, more toward the left, the spleen over toward the left of the stomach. You've got the large intestines and small intestines, and of course the rectum and the anus. So make sure that you review the anatomy of the GI tract. The only equipment you're going to need for this particular skill of abdominal assessment is your stethoscope. So when should you conduct an abdominal assessment? Well, when there are digestive problems, if somebody's complaining of digestive problems, whether it's a history of it or current, somebody presents with nausea and vomiting, diarrhea or constipation, bright red or black tarry stools. Incidentally, bright red stools are going to be indicative of a lower GI bleed. Black and tarry are going to be upper GI. Feelings of bloating or excessive gas, alcohol consumption in excess, and complaints of abdominal pain are just a few examples. But anytime somebody's complaining of pain, discomfort, problems in the abdominal area, that should cue you in to be focusing on an abdominal assessment. For the objective assessment, it is really important that you follow the order of things. So we are always going to start with inspection, which of course you're looking for pulsations, peristalsis. If you're not familiar with these terms, you need to look them up. Any kind of discoloration, that the umbilicus is midline. And the reason for that is there could be a tumor or something like that that is pushing the umbilicus over to the side. And we want to look for protuberance. So you want to look protuberance up too. That is when a hernia or anything that is making the abdominal area stick out. So inspection is always going to be first. And the reason for that is because we don't want to be touching, putting our hands or anything on the abdomen before we listen, because it can impact what we hear. The second part is auscultation, and you're going to be auscultating 4 quadrants for bowel sounds. And bowel sounds are just a gurgling sound you hear when you put the diaphragm of your stethoscope on each quadrant. So you'll listen once the bowel sound is positive, you hear that gurgling sound, it just sounds like the stomach is growling, which it is. Then you move to the next quadrant. If you don't hear bowel sounds in one quadrant while you're listening, you need to wait at least 5 minutes before determining that it's a silent bowel. A silent bowel means that there are no bowel sounds, that the bowel is not moving, there's peristalsis is not present, and that is considered a medical emergency. So it is important that you wait the 5 minutes before determining it's a silent bowel, because you certainly don't want to report an emergency when there isn't one. The next step would be percussion, which you're not actually going to perform, but again, we're going to talk about it. And then there's palpation. There's light and deep palpation. For this class, we're only going to perform light palpation, where you put one hand and on the abdomen, and you're assessing for pain, masses, guarding, and organomegaly. And organomegaly is where the organs would be unusually pronounced. So any of these terms that you're not familiar with, you need to make sure you're looking up. So just going over some of these things for details of what you're looking for. When I mentioned the fact that you're going to be inspecting and looking for pulsations, I'm going to show you a YouTube video that shows an aneurysm that is pulsating. When you look at a partner's abdomen, you may see a regular pulse from their heart, and that is not abnormal. A pulsating aneurysm is much more pronounced. So let me show you that on YouTube. So you can see how pronounced that pulsation is. And that's an example of an abdominal aortic aneurysm, which would be considered an emergency. That's a pronounced pulsation. The other thing we're looking for is a protuberance from a hernia. And this is an example of a protuberance, an epigastric hernia, abdominal hernia, incisional hernia, where you see these little bumps. This is also considered a protuberance. So these are the things that you want to look for as far as anything sticking out of the abdomen. The terms that you want to be familiar with are normoactive, hyperactive, and hypoactive as far as bowel sounds go. Normoactive just means it's normal, and it's going to be an irregular, high-pitched gurgling sound about 5 to 30 times a minute within each quadrant, and that's normal. Hyperactive would be where it's loud, high-pitched gurgling. Sometimes you can even hear it without a stethoscope. Many times you're going to hear hyperactive bowel sounds when somebody has a GI virus, where they've got diarrhea. Hypoactive would be where the bowel sounds are softer, slow, and sluggish. You can expect hypoactive bowel sounds after somebody has had abdominal surgery. We do expect that post-op, but we want to hear the bowel sounds coming back to normoactive. However, if somebody has not had abdominal surgery and they have hypoactive bowel sounds, that's something that we would want to keep an eye on. So we talked about percussion when we went over lung sounds. So there's also percussion of the abdomen. And again, we're using our hands to listen to different sounds so we can get an idea of what's going on within a body cavity. Normal percussion over the abdominal area is called tympany. When dullness is heard with percussion over the abdominal area, there may be fluid or even feces if we're trying to assess if somebody's got an impaction. Could also be a tumor. If you are percussing over the liver, you may hear a dull sound as well. So let's look at a YouTube video about percussing the abdomen.
Lightly percuss the abdomen to assess the distribution of tympany and dullness. Tympany indicates gas in the stomach or intestine. Dullness suggests fluid or feces.
So that's the gist of percussing the abdomen. Again, I'm not going to have you demonstrate that, but you should understand if the physician or advanced care practitioner documents in the chart the results of percussion of the abdomen, tympany would be normal and dullness would not be. For the abdominal assessment, as far as what I expect you to demonstrate, you're going to want to get your rubric because I have the specifics of what you need to do. And get ready to practice along. I'm going to put this Edpuzzle link in a question format that'll pop up, and I expect you to go through that and practice on an individual at home. We likely will not get time in the classroom to do this. If we do, great, but I don't think we will. So again, the skills are not terribly difficult, but you do need to practice on somebody so that you actually are going through it. Otherwise, you're going to stumble through when you're trying to demonstrate it to me. So make sure that you actually practice on someone else, whether it's a partner, somebody at home, it doesn't matter. And this concludes the presentation for abdominal assessment. Again, make sure you're doing your reading, that you are going through ATI and my nursing lab, I'm sorry, so that you get everything that you need to in order to be able to demonstrate and take the exams for the class.